they had two patients with the exact same problem. That is, both had knee pain, particularly not during exertion, but rather an aching, pulling pain in the knee. Both of them. As I noticed, the patient is sitting and she bends her knee like this, just like this, constantly like that. Here is the spot, like this, and we here. I asked, does your knee hurt? She says, yes. How does it hurt? And she says, it mostly hurts either when I sit, it starts to ache and pull and hurt, or when I sleep, I wake up because of the nagging pain. And the second patient is exactly the same. Everything is identical. One is a bit younger, the other a bit older, but the pain is exactly the same. And I wanted to share with you, it's very simple how to get rid of it.
Look, in general, you'll like it.
We need to find the kneecap and go a little higher, with fingers, with these knuckles. You need to massage well here, especially from the inner and outer side. Here, once, like this. From the knee and higher, from the knee and higher, from the knee and higher. Don't hold back. Especially on the inner side, it will be very painful. But it needs to be done because there's a rough group of muscles here. No matter how strange it sounds. And in this way. And all the way to the top. And spend at least 2 or 3 minutes on this. And in this way, don't hold back. Especially here and especially here. And press yourself well. Good, good, good. Even if a bruise appears, it will quickly pass. Bruises on the legs disappear quickly. Although they appear very quickly. And if you remember yourself, it will noticeably become easier. But the key point is not in this muscle. It's important, but not very. Now, there is a very important muscle responsible for knee pain, specifically nighttime pain. Not during exertion, but specifically nighttime. In general, the knee itself, I'm going to say strange things right now. Most likely many will disagree with me, but I'm absolutely sure. The knee itself does not hurt, even if you have arthrosis, if the knee is severely damaged, with 2 cases of arthrosis or something else. The knee itself, as a rule, does not hurt. Pain, comes from arthritis, inflammation. And even when inflammation occurs, strange as it may sound, it is not the knee itself that hurts, but the soft tissues around it. That is, inflammation causes tissue tension, resulting in pain. And even if you have arthrosis, arthritis in general, a complex condition with the knee, they didn't have it, then with this kind of movement, you can relieve your condition. That is, periodically apply pressure. Of course, you can't cure arthrosis, and arthritis may be relieved for a moment, but not significantly. In general, for arthritis, the simplest way is to reduce the load on the knee. Well, roughly speaking. But the pain I just mentioned, specifically the night twisting pain, maybe it is directly related to arthritis and the resulting muscle imbalance. So in simple terms, are you afraid to step on your knee? The muscles readjust and the most important muscle tightens, causing this pain. That's all. The muscle is called the iliopsoas. In general, I probably have my own professional deformation due to my work. That's how it turns out. And I am almost sure that almost all problems, everything related to the legs, lower back, groin, sacrum, buttocks, is solved with the help of one single muscle. It sounds incredible, but I am absolutely sure that this is the case. And the name of this muscle is the iliopsoas muscle, just like that. Or PPM, as it is more commonly known. This muscle most often causes chronic aching pain in the knee. When we sit or when we stand, not stand, but when we, for example, lie down, or for example at night. Now, the simplest way to get rid of this pain. Since we assume that we have knee pain. Therefore, in the exercise, wherever we need to step on the knee or do something with it, we basically don't do them. Because I've seen a lot of exercises where people walk on their knees, on their kneecaps, to supposedly improve arthritis or something else. And I don't believe in that. We need to stretch, as I showed initially. Not stretch, but do massage. And now here is how to stretch this PPM. The safest way. In general, if it were possible to keep just one exercise, the safest and easiest, I would do it. Like this. And the sore leg goes back, the healthy one forward. And here we make this kind of movement. We try to stretch forward, trying to feel the tension here. And like this at least 20 or 30 times. Like this. 1, 2, 3. We try to stretch this area. You might feel tension here, but mostly here. And move your leg. Move your leg and search for the pain. Like this. Do it this way, then do it that way. Then, for example, do it this way. So while moving your foot, search for the epicenter of the pain. Look for what stretches the most. If you do this for 2 or 3 weeks, or even faster, if you do it for 2 or 3 days, you will feel significantly better. Just like that. But my favorite exercise, despite recommending this one for you, is called the exercise for the lazy. For this muscle that I like the most. A roll, a ball, a small pot, anything will do. You need to place it under your belly, under the navel, right here. If it's a roll, place it right in the center, slightly below the navel. Here's my navel. Don't place it there and lie on top of it. I mean literally like this from above. Just lay down. And just lie down. Can you imagine an exercise where you just lie down and everything heals? Not just that nagging pain in the knee, which is very destructive. Imagine, these two women have had it for a very long time. Yes, and in general, a ball or a convenient roll like this. Just lie down and simply enjoy life without pain. That's it. I wanted to share. I really hope that this will help you. Perhaps those who watch the video to the end will say that it doesn't work, that it's not true. But I am still convinced. Let's say I'm a practitioner, I work every day with many patients. I've been doing this for many years, sometimes seeing 10, 12, or even 13 patients a day. Well, because I work a lot, I'm used to it, and I can't change that. And I share with you what I believe in. I only believe in simple things. I don't believe in complicated, convoluted combinations. Here are the simple ones. There is pain, there is a muscle. Did we eliminate the pain? The pain is gone. I can also recommend, there will be a link below in the description, my course on relieving chronic pain, specifically in the lower back, leg, and knee. Click the link and basically enjoy. It's like that. To everyone who listened, like and subscribe. Thank you, friends.